Hello guys, welcome back to the channel Side Dental Vlogs, and today I'll be discussing about a very important topic, that preparation about Neet Mds for second year subjects. So there are three main important subjects in second year which you need to read very nicely, and it holds a lot of gravity and a lot of importance. So those three subjects are Pharma, Micro and Pathology, which you need to read in a very different way. So today I'll be telling you in details what are the things which you need to read in Pharmacology. So first of all, in Pharmacology there are many books which you need to have actually. So your dental students, they are reading K.D. Tripathi. For medical students you have to read Pharmacology. So it's a very nice book, and believe me guys, from the very top to the till end of the book you have to read that K.D. Tripathi for clearing your entrance examinations in Neet Mds. I am not telling to read the entire book after internship or during internship. You need to read this book entirely 2-3 times in your second year, so that you can apply the knowledge which you have gained in your second year in the entrance examinations later on. So by reading the entire book, what will be the benefits? Whenever you are solving any MCQ and any doubt rises in your mind, at least you know from where the MCQ is being asked, from which chapter, from which angle, from which side. Means you have to read everything in second year from the Pharmacology book. It's not like that you are reading 10-year question papers. It's not like you're reading the last 5-year important ones. It's not like your seniors, what they have marked, you are reading that only. You name it, you read anti-helminthic drugs, anti-cancer drugs, anti-tubercular drugs, rifampicin. Everything which is required, you need to read everything in your second year of Pharmacology if you want to crack the Neet Mds, and Pharmacology is a very important subject. So first I'll let you know the books. Medical Pharmacology by K.D. Tripathi. Then you need to read Satoskar also few chapters. Then you need to read the Lipincot's Pharmacology, which is very nice book. So when you enter into the second year, first go to the library and search for the Lipincot's Pharmacology book and read it one by one. The book is very nice. It is given very nice diagrammatic representation is given in that book. After reading one chapter from that book, you can just shift over to K.D. Tripathi medical students and you can read. So what they ask in entrance basically from Pharmacology. So they will ask you all about anti-helminthic drugs. They will ask you about NSAIDs. They can ask you about steroids. They can ask you anti-cancer drugs. They won't ask you the dosage and all, right? So they will ask in entrance. They will ask about what is the drug of choice for this thing. What is the drug of choice for this thing? So these kind of questions, plus cholinergic drugs is a very important chapter in Pharmacology, as well as anti-tubercular drugs. The tubercular regimen they ask, and they also ask about the various drugs administration, how it is administered, the intramuscular, the bioavailability of the drug, what is the dosage. In some, for few diseases they will ask you the doses also, like, and some specific medicines for some specific diseases like trigeminal neuralgia. So these kind of questions they will ask in very minute detail, and you need to read not once, twice, but thrice. 3 to 4 times you have to read K.D. Tripathi in your life. See, I started reading Pharmacology after finishing my first year only. I had some start reading like that. You read paracetamol, which the common drugs which you prescribe or you see daily, like your parents. Sometimes they will give Calpol 500. So you read about paracetamol. So you like paracetamol. Poisoning, you read N-acetylcysteine is the antidote for poisons. Then venoms. All these things. Then hematinic drugs they are asking. Anti-helminthic drugs they are also asking a lot about anticoagulants. So what is the drug of choice for this thing, that thing? What are the cardiac complications? What is the antibiotic prophylaxis in these patients? So mainly dosages they are asking about antibiotic prophylaxis. Suppose the patient is suffering from subacute bacterial endocarditis. So what is the antibiotic prophylaxis according to the American Association, according to European Association? So these things you need to know. The latest specifications given by the WHO, and cardiac system is very important. Everything which is related to cardiac you need to read in details. Calcium channel blockers, any medicines which leads to some infections or secondary growth or some gingival hypertrophy in the oral cavity or some pigmentation in the oral cavity, those kind of drugs are very important, which are having any kind of for example, I am telling like if you use tacrolimus ointment, right? Tacrolimus ointment is, what is the immunological name of tacrolimus ointment? It is FK506. You must be knowing if you have read oral medicine books or you have read Schaefer's. So the tacrolimus is used to heal the lichen planus lesions. But the USA has also given a black box warning against tacrolimus that long-term use of tacrolimus may cause cancer itself. Remember why you're giving the medicine tacrolimus. You're giving to heal the oral lichen planus and the potentially malignant lesions, but it can itself cause oral cancer. So this is, the prevalence is very less, but this was given by US black box warning. I don't know the meaning exactly of what is the black box warning, but in entrance they will ask you these kind of questions. Following drugs were given black box warning by the US Food and Drug Administration. So they will give you 4 choices, and in that you have to tick tacrolimus. So these kind of questions are they will ask like this. And some more important topics in pharmacology are like what are venoms, snake venoms, from which venom, which is the antidote of which medicine. Suppose you are getting poisoning, so you can give activated charcoal, and these kind of questions, like little bit tricky questions they will give you. They will not give you straightforward questions like what is the drug of choice for this, what is the drug of choice for this. Earlier they used to ask these tricky easy questions, but now the questions have become more trickier, like which of the following drugs are given with local anesthesia in a cardiac patient. So they will tell you the ratio, 1:1 lakh, 1:10,000, 1:100, 1:1 crore. So these kind of ratios they will write to confuse you. So you need to read from 2-3 different books, so that you need to know the units also. Penicillin, how many units they are given. अब units किसको याद रहता है? नहीं, आजकल सब रोज में चलता है. They will ask about insulin, diabetes. This is very important. Diabetes का insulin कौन सा है? Pork insulin या human insulin. So they will confuse you in any way. So you need to actually इसको ratify करना होता है. Pharmacology समझ के ratify करना होता है. It's very difficult subject. I feel you need to have an in-depth knowledge, plus one very important thing I would like to suggest कि pharmacology कब easy हो जाता है? When it's easy. It's easy if you keep a small book. It's available only of the classification of the drugs. का एक छोटा book मिलता है guide जैसा. So you need to have that book always in your bag if you are preparing for NEET. So whenever you are going through bus or whenever you are traveling, whenever you are going, to just go to that. They will give the classification anti-helminth drugs. Oh, this is the drugs used for anti-helminth. So during entrance, ये सबसे ज़्यादा काम आती है. The most important tip I would like to give is you should know the classification of any drug. Suppose I ask you fluoxetine. What is fluoxetine? Right? So अचानक से याद नहीं आएगा. So you need to know. Okay, this is a specific serotonin reuptake inhibitor (SSRIs), which is the anti. Then suddenly everything will come in your mind. Oh, it's an antidepressant drug. Oh, this is given this. This is given in bipolar disorder. This is given in general anxiety disorder. So these kind of thinking and reading should be there. Means your brain should be will be able to classify. Okay, this is going in that line, because it's a huge subject and it's very difficult. So similar kind of representation is given in the Lippincott pharmacology. You can read about it. You can go about it. It's very nice, right? So ये classification का book is very much necessary. You need to have. It's available online and available in all the shops near your or dental or medical colleges. You can order the book also online. So next is microbiology, a very very important subject. Still very boring subject, but still it is. If you start understanding microbiology, then it is very good. So microbiology main question, very important. Every year question will be there from hypersensitivity reactions. It will be there. Some questions will be there from immunoglobulins. So you need to read all the hypersensitive reactions, type 1, type 2, type 3, type 4, delayed hypersensitive reactions. मतलब पूरा details में पढ़ना है. Okay. You can also read it from the Harper biochemistry. Also, it's given some hypersensitive reactions. But microbiology आपको बहुत मनपल्ली से पढ़ना है और पानिकर से पढ़ना है. पानिकर वही मनपल्ली and Panikkar. Sorry, Panikkar, not Manapalli. Manapalli is dental materials. You have to read from Panikkar microbiology. So Lippincott's microbiology भी available है, but I would not suggest you go for Lippincott microbiology. You read Panikkar. It is it's a very nice book for entrance fully, शुरू से लेकर last तक. Plus they will ask you a lot about complement system, immunological things, immunoglobulins, antigen antibody reactions, blood transfusions. So these topics are very important. Microbiology plus microorganisms. Which microorganism is in which agar or which media, which microorganisms will grow in which media, like the rabies virus shape and size. They can ask any shit question they can ask you from micro, and it's very difficult to understand. So shape of the rabies virus is bullet shape. So this question came during my entrance, and how can you know the shape of the virus, man? You're a dentist. So, but these kind of questions they do ask. I don't know who is setting the paper. So I thought initially I'll make a video on who is setting the BDS Neet MDS papers. So I thought it will be a little controversial, so I didn't make a video. Like these kind of questions is of no knowledge, and the only thing I remembered when I was reading Panikkar, there is a shape. When I was reading some chapters, there was a shape of the virus which is given like a bullet. The picture was there, so I thought it may be that rabies virus. So later I checked it, the answer was correct. So this is the importance of books. If you would have read it from an MCQ book, and it would have you would have not remembered the question. So but I remember that second year I had read somewhere, okay, bullet shape virus, rabies virus. So you need to read Panikkar very thoroughly. Plus all the entrance books are also nice in microbiology. You can first read from the book, and later on when you do your internship, you can read from the books which are given for all these microbiology, Pulse, Bhatia, Gauri Shankar. Then individual microbiology questions from Ashish Gupta, Mudit Khanna, the medical entrance books. One is for the AIPG Neet MDS. The other one is for the Ashish Gupta is for the AIMS MDS. So these books you have to purchase. So I would suggest कि आप अगर second year में खरीद लो, किसी से xerox करवा लो उसी बुक को, थोड़ा थोड़ा अगर पढ़ते रहोगे ना तो काफी knowledge आएगा, and you will have an idea of how to go about the entrance exam. You will have an idea of how to read for the question. See, for getting into entrance, you have to read, but you have to read in a very smart way, right? You cannot just haphazardly keep on reading one book 5-6 times, but you have to keep the entrance book sideways, while keeping the main textbook along. Means you have to keep 2-3 books in front of you, and you have to see, okay, this is the pattern of the question, so I need to read in this way. Now comes pathology. Pathology का बहुत सारा books है, लेकिन pathology I would suggest कि pathology आप normal book जो आपको दिया जाता है, आप second year में पढ़ते हैं, आप उसी से पढ़िए जिससे आप पढ़ रहे हैं. लेकिन इन डेप्थ अगर नॉलेज चाहिए आपको पैथोलॉजी में, तो उतने ज्यादा पैथोलॉजी से क्वेश्चंस नहीं आते हैं. यूजुअली दे आस्क फ्रॉम इन्फ्लेमेशन, शॉक, ऑल दिस क्वेश्चन दे विल बी आस्किंग वुंड हीलिंग. So most of the things are covered in oral pathology, and wound healing, inflammation is easier compared to other subjects. So you can cover these questions when you are reading about all these things from the main MBBS wala question papers like Ashish Gupta, Mudit Khanna. So you will cover everything. They will mainly ask you about gene mutation, P53 gene, guardian of the genome, all these questions they will ask you. But pathology, mainly you have to concentrate on the MCQs, because the pathological MCQs, they are mainly asking from the general pathology book, which is, the name is, I forgot. I'll just give it in the description box what is the name of the book. So those books are very important. I remembered the name just before starting the video, but now I am not able to remember. I think it is pathology books. One though we are usually reading while we are studying the second year, but while studying from the AIMS AIPG books, Ashish Gupta, Mudit Khanna, in their pathology is given very nicely with very big explanations. So your books, standard books को पढ़ने का उतना जरूरत नहीं है in pathology. Just P53 gene, diabetes, hypertension, ये थोड़ा बहुत आप पढ़ लीजिएगा. So it is very useful. So these इन 3 टॉपिक्स को मैंने काफी ज्यादा डिटेल में आपको बताया है, और भी डिटेल में बताऊंगा. देख के रिस्पॉन्स वीडियो का कैसा आ रहा है. बट आई रियली वांट यू गाइज टू क्रैक नीट एमडीएस एंड शाइन इन लाइफ, बिकॉज आजकल क्या हो रहा है ना, डेंटिस्ट्री का ना बहुत ज्यादा लोग ना नेगेटिव कर रहे हैं. मतलब आई डोंट लाइक इट एट ऑल, बट बिकॉज नेगेटिव, डेंटिस्ट्री इज अ वेरी गुड ब्रांच. द ओनली थिंग, पीपल डोंट स्टडी प्रॉपरली गाइज. अच्छे से पढ़ाई करो, देन यू विल बी एबल टू शाइन इन लाइफ. आई एम टेलिंग यू, कीप इट इन रिटन. BDS is exactly like MBBS. MBBS when you are studying the entire human body, BDS also you are studying the entire human body, plus specific, you're only not reading the anatomy of the legs or anatomy of the extremities, but you are reading everything. The head and neck carries the entire anatomy, plus cardiac system, everything you are reading, guys. Just don't take it lightly, take seriously, read nicely from various books. अगर पढ़ने का मन नहीं हो रहा है, take a break with friends, watch 2 or 3 movies, then start studying again. At least study for 3 to 4 hours with full concentration for NEET, then it will be very useful for you people. I am saying, once you pass out and once you have not done it properly, you will always regret in your life. that what I have done, my God, I would have studied better. क्योंकि एक बार time never comes back, my dear friends. समय चला जाता है, आप बूढ़े हो जाओगे, सब कुछ हो जाएगा, लेकिन वो जो खोया हुआ समय है वो कभी आपके पास वापस नहीं है. अगर आपको मेरा वीडियो पसंद आए प्लीज लाइक कर दीजिएगा, इंस्टाग्राम में फॉलो कर दीजिएगा साइड एंड ब्लॉग्स. टिल देन टेक केयर.